Well, hello, everybody. Hold on. Is this working? There we go. Well, hello. Welcome. I think democracy is breaking out in Petaluma, California, and it looks good. I see some good-looking pink hats out there. Thank you for that. On behalf of Senator Bill Dodd and myself, we welcome you to this town hall, nominally a town hall to discuss health care and the Affordable Care Act, but by being here, by being part of this conversation, you're part of something that's much bigger than just that. So thank you for that. There's, of course, this rumor going around Washington that people are swarming these town halls because they're professional protesters paid by George Soros. So, let's just go ahead and ask the question, how many of you are professional protesters paid by George Soros? Okay, great. Nice work if you can get it, huh? Excellent. Let me ask a more serious question. How many people here are at their very first town hall? Nice. That's pretty fantastic, and I'm not surprised by the number of hands, which was probably about 2/3 of the hands, I think, in this room just went up, at least. We'll come back to that subject in a moment. I first want to say some thank yous. I want to thank the County of Sonoma for helping us provide this wonderful venue. The Petaluma School District provided the chairs you're all sitting in, so thank you very much for that. We're very grateful to Petaluma Community Radio and Rob Tamaszewski for working this weekend to make sure that our audio live stream for this town hall is going to be available for those who could not fit inside this building. And my apologies. We actually have people on a wait list who we could not squeeze into this room because we'd be violating the fire code. So we've got some remote streaming going on right now, and we'll just keep looking for bigger venues, and we'll keep trying to have more of these conversations. But I thank you very much for your patience. We've got a whole bunch of elected officials, I'm guessing, in this audience, but we don't have a very up-to-date list of them. So let me do this by way of the traditional introduction of elected officials. If you're an elected official, a local elected official that works hard for this community, would you please just stand and let us appreciate you here? Do we? There we go. Maggie, I see. Thank you for that, and thanks, of course, to Senator Bill Dodd, who's not here, but you're going to hear in a moment from his representative, Logan Pitts, and to our wonderful panel who will introduce themselves in just a moment. All right, so why are we here? Something is going on in this country, and I am seeing it all over my district. Everywhere I go, people are worried. Obviously, our nation's politics have changed rather seismically in the last few months. A lot of people are afraid. I am much more encouraged by the millions of people that are making that journey from fear and despair to positive action and taking control of their democracy and getting this thing turned around. And I think that's probably what animates most people in this room. But look, we saw it in the amazing Women's March. I see it in these new groups that are popping up everywhere, Indivisible and others. Any Indivisible here? All right. Wonderful. Great to have you here. My district spans a third of the California coast, from the Golden Gate Bridge all the way up to the Oregon border. And I have never seen anything like the engagement I'm getting everywhere I go throughout this district. My colleagues back in Washington tell me they've never seen anything like this, even going back to the Vietnam War, even the civil rights movement. There is a level of engagement and determination and peaceful resolve in this country, the likes of which many people have never seen, and I find it quite inspiring. So thank you for being a part of this. Now, it's our second time for a town hall here in Petaluma. We had one over at the Santa Rosa Community College campus a few weeks back, and it was focused on climate change and the environment. We overflowed the room and had satellite rooms. It was remarkable. I've had the same experience at town halls in San Rafael, in Weaverville, in Trinity County. We packed a wonderful little performing arts center in Weaverville, and then we went to Arcata. 1,200 people turned out in Arcata. We got in big trouble with the fire marshal in Arcata, but it was pretty wonderful. Same thing in Ukiah, had a spillover packed room and a wonderful conversation. And then next Monday I'll be doing another town hall in Marin, again on the focus of healthcare. But ordinarily, I've got very few days in the district this year. The Republican Congress has scheduled us in Washington a lot. So ordinarily on my few days in the district, I'd be doing field visits and having all kinds of meetings and doing the things that a congressman does when he gets back into the district. But I feel like right now the most important thing I can do is this, to have as many of these big public community conversations as possible. So we're going to keep doing it. And this won't be the last chance for us to have a gathering like this. So let's talk a little about how the program will work. We want to get to as many questions as possible, and we'll do that in two ways. One will be these question cards, and my staff are located throughout the room. They've got cards. If you want to fill one out, just raise your hand, and we will collect them. I want you to know that we don't screen any questions. You can ask us about anything you want. However, what my staff might do is combine them if they're all asking the same thing. And if we don't get to your question, we will try to follow up after this town hall to make sure that if you came here with something to say to me or to get a specific answer, we'll find a way to get it to you. The other way we'll take questions is at this podium right over here. So some people prefer to ask their question or to make their statement asking for a response in person. You're welcome to do that too. We probably won't be able to get to quite as many of them, but we'll do our best. And to keep things moving and cover as much ground as possible, I'll just ask some basic courtesies for those of you that choose to come to the microphone. We'll call about 5 of you at a time because we don't want people just standing there. And then as the line dwindles down to 1 or 2, we'll call on a few more to come up. I'll ask my staff to do that. Please don't ask a question that's already been asked. That's just redundant and keeps us from getting to other questions. It's tough to limit questions to 1 or 2 minutes, but I hope you will try your best, and maybe all of us can help. If someone just needs a little encouragement to wrap up that question, why don't you feel free, all of you, to just give them a little quiet applause at first, and then maybe a little more encouragement as needed. Sometimes people just need a little support, and they'll get there, and they'll get it done. Okay, I'm going to say just a few more brief words about healthcare and this, what I consider a threat to our healthcare safety net, and then I'm going to hand it over to our panelists to introduce themselves. But first, Logan will say a word about Senator Dodd. One last housekeeping thing, though. I had a woman call the office recently and say, I'm a supporter of Donald Trump, and I want to come to your town hall. Will I be safe? So, it's too bad that anyone, whatever their political views, would actually have to worry about that. But I do want to say I hope there are supporters of Donald Trump in this room, and I hope they will feel free to be part of this conversation. Whatever your politics, you're part of this community, and I want to have a conversation with you. I know everyone in this room wants that too and wants to make sure that it's civil and constructive. So please, everyone, regardless of your politics, you're among neighbors here, and we're going to keep it civil and positive. Now, let's talk just a little about the Affordable Care Act. I didn't write the Affordable Care Act. I didn't even get to vote on it. It was passed before I got to Congress. And while I recognize that it's not perfect, it certainly didn't fix all of our health care problems. I also recognize that it made quality health care more accessible and affordable to millions of Americans, including an awful lot right here in the North Bay and on the North Coast. It's not single payer, which I would prefer. All right? But it is an important step along the way to some of the things that I'd like to do to improve our healthcare system. And we can talk about opening up Medicare and moving towards single payer and some other things that I think need to be part of the conversation. But the Affordable Care Act, I think, was an important step forward. And we should try to improve it, not repeal it. It's very clear to me that if we were to repeal this law, certainly without putting a really adequate, comprehensive replacement in place first, the impacts would be devastating for millions of people, and the data that I've been able to see just from my district really confirms that. The impacts would be quite devastating for this region and this community. What's at stake? Well, without the protections of the Affordable Care Act, if those were actually to be repealed, families and individuals could once again be denied health insurance because of pre-existing conditions, even really common conditions like asthma or diabetes. Young adults could lose their coverage under a parent's insurance plan. Seniors could lose access to lower prescription drug costs. And, of course, millions of Americans who don't even use the Affordable Care Act exchanges or the Medicaid expansion would likely see their health care costs go up because all of these people who lose insurance would once again start showing up at the emergency rooms to get the care when they need it. And that is very expensive, and those costs get passed along to the rest of us, even if you're on a plan provided by your employer. Talk about a few numbers. Here in California, 4.2 million individuals have gained health insurance since the Affordable Care Act was enacted, and they could lose that coverage if it were repealed. I want to kind of contrast some of the things that President Trump has said recently with reality. He has said, he said it, alternative facts. He said in his speech, for example, that without providing any details, that they've got a plan, a replacement plan, and we're all just going to love it. Care is going to be great. It's going to be really affordable. Everybody's going to get insurance, and it's just going to be great. Well, that's nice. Wouldn't that be nice? The Congressional Budget Office has a different view of what is likely to happen under the Republican plan to repeal and maybe replace the Affordable Care Act. They talk about some nightmarish consequences that involve millions of people losing their insurance, major hits to the federal budget, and increases in health care costs. So this is a pretty devastating, potentially, issue for this country. And if the Republicans do have a plan, I really need to see it. I'm told they may have unveiled something just today, right? Okay. So I haven't had a chance to look yet at what it is. I think some of our panelists may literally be checking their smartphones as we talk tonight to find out what is in this long-awaited Republican replacement plan. But I will tell you the politics of moving whatever the heck it is forward, given the serious fractures in the Republican caucus, are really daunting. You've got their Freedom Caucus, which is several dozen, maybe 40 to 50 members, who've said they don't even want to do a replacement plan. They just want to repeal Obamacare. And they don't care if the Congressional Budget Office says that that's going to break the bank and cause all kinds of problems. They just feel like they've got to keep that promise. That's enough to really gum up the politics on their side. Meanwhile, over in the Senate, you've got a growing number of Republicans that want to do something that looks a lot more like improving the Affordable Care Act and maybe not repealing it or even fully replacing it. So whatever is in this plan, my colleagues across the aisle have a long way to go before they can navigate the politics of this and move it through both houses of Congress and get it to President Trump's desk. This is complicated stuff. Some of you may have heard President Trump recently say that nobody knew health care could be so complicated. Who knew, right? Well, only if you're a billionaire that never had to worry about health insurance and never worked on it or never talked to anyone about it would you say something so incredibly naive and uninformed. Everyone knows health care is really complicated. That's why we really need to have this conversation, and that's why I want to hear from all of you. The numbers and statistics are great. They're things that I'm really trying to absorb and get my head around. We need to know that. But maybe just as important are the personal stories that you hear about the lives that are impacted, lives that have been saved by the Affordable Care Act, lives that could be lost if we recklessly pull the rug out from under our healthcare system. So I want to thank anyone in this room participated in my healthcare survey. I sent it out by email. Thank you very much. We sent this out to both healthcare providers and to individuals. Got back over 1,000 personal stories on the Affordable Care Act. Most of it positive, not all of it positive, but an incredible number of incredibly powerful stories. People who had a serious health event and were fired by their employer and couldn't even go to the cardiologist because they couldn't afford the incredibly expensive COBRA coverage. This is pre-Affordable Care Act. So the gentleman that shared this particular story with me waited 2 years after having open heart surgery without getting any health care, finally was able to get coverage under the Affordable Care Act, got in to get the care that saved his life in the nick of time. And, he was fired by his employer. So he was a classic person out there with a pre-existing condition that would have been in real trouble. I've heard from all kinds of parents who have children born with very serious health care complications, and they're told that their child, maybe by the time they're a teenager, will hit a lifetime medical cap. And that means if they're not able to stay on their parents' plan until they're 26 and hopefully find something to take care of them beyond that, they're going to be uninsured real quick. And that obviously could devastate a family and ruin a lot of lives. More stories than I can even share with you in the time we have here. But I hope to hear some of yours tonight as well. And with that, I want to hand off to Logan Pitts, who will, I think, give us regrets for State Senator Bill Dodd, who's a great local partner that I work with all the time, who's really important from the state perspective because Covered California is a very successful health exchange under the Affordable Care Act. And obviously the things that we're talking about back in Washington are going to have a big effect. They've got a huge stake in the outcome, and I'm really glad to be working with Senator Bill Dodd. Logan?
Thank you, Congressman. Senator Dodd couldn't be here. I'm not Senator Dodd, I'm sorry to say, but my name is Logan Pitts. I'm his Sonoma County field representative, so I help him cover his big district. It includes 6 different counties, and right now he's on the floor of the state Senate. He expected to be here right now, and he wanted to stay there to make sure that he could vote on Senate Resolution 22. And this resolution urges immigration authorities to not detain people at sensitive places. And what we've been hearing around the state is that people are dropping their kids off at school and minutes later being pulled over and detained. And this resolution simply asks them to not do that, to respect the families who are involved. He wanted to stay and vote yes on this. Unfortunately, his Republican colleagues all stood up in opposition to this resolution, took the maximum amount of time that they could take to speak, and unfortunately kept him on the floor of the Senate. So he wanted me to send his regards that he couldn't be here. He'll be in Petaluma again. Looking forward to butter and eggs, of course. And it was really important for him to be here, but I'm sorry he couldn't be. So I'll just talk a little bit on what's happening at the state level. Healthcare exchange is $20 billion of the state budget if it's eliminated. It's 17% of the entire state budget. And as Congressman Huffman knows from his time in Sacramento, there's no easy way to fill that type of hole in the state budget. It's simply unacceptable that rug would get pulled out from under us. And we're not just going to be reactive. We're working on plans to make sure people keep their health care, that there is health care for everyone. That is really important to Senator Dodd. As a former county supervisor, he was often on the front lines of delivering that care to people. It's an important issue to him, and he's going to fight for it. The legislature has retained Attorney General Eric Holder. He is going to help us push back legally on these efforts, and that's really important. You have to do it on multiple fronts, and the legal front is an important one. We also just opened an office in Sonoma County. It's in the state office building in downtown Santa Rosa, so I want to invite any of you to stop by anytime. Come in, say hi. We're going to be having an open house in a few months, so stay tuned for that. And I'll be in the crowd. I'm going to pass off the mic and get off the stage to help get your questions, because it's really important for everyone to hear what you have to say. So just want to say thank you for having me. You'll see Senator Dodd out in your community again, and he really regrets that he couldn't be here today. So thank you.
Terrific. Thank you, Logan, and thank you, Senator Dodd. Why don't we start with Carol Estes to my right, and we'll go down the line and ask our panelists to just introduce themselves. We've got a lot of knowledge and expertise up here on the stage with me, and as soon as we wrap these introductions up, we'll go right to your questions.
Hi. I have been on the faculty at the University of California, San Francisco for 45 years and very much involved with the National Committee to Preserve Social Security and Medicare. And for the last 15 years, we have been working on Capitol Hill. We're a membership organization, but very much committed to expanding benefits, protecting benefits of Social Security and Medicare. And just we want to say we have paid into it. We own this program. We have earned our way to these benefits, and we need them. And we're not going to let them go or be cut or privatized. Thank you.
Good afternoon. My name is Frank Nelson. For 17 years, I was a skilled nursing administrator and saw the for-profit side with shareholders, with profit margins, and with Medicare beneficiaries in that setting. Several years ago, I came over to the other side, the nonprofit side, to HICAP, the Medicare Health Insurance Counseling and Advocacy Program. As the Congressman mentioned, healthcare is complicated. Medicare is complicated. HICAP is through the Area Agency on Aging and the California Department of Aging, in which anyone who has questions or wants help with understanding their Medicare, the A in HICAP is advocacy, getting advocacy, sorting through some of the complications. It is a pleasure to be on that side of helping people, of managing a program that covers 6 counties. It's a statewide program. The 6 counties are our particular region. And as people need help, as they have questions, as we hear the stories in sitting individually in the small locations, the small towns where we have counselors, in the larger centers where we have counselors also, having that help to sort through the maze is critical. The Affordable Care Act, of course, impacts Medicare in ways that help people better afford their medications and access preventative. It's important to understand that, and I'm glad to be here to hopefully answer some questions and be available. Thank you.
Hello, my name is Rob Lane. I am with Partnership Health Plan of California. We are actually the nonprofit public agency that's responsible for providing care to the Sonoma County residents, the Medi-Cal residents of the state. All of our members are the most vulnerable populations. We're talking about children, we're talking about people with disabilities, those with low incomes, and those that are pregnant. We currently serve about 111,000 people here in Sonoma County. Just a couple of quick statistics. The ethnic makeup of the county is we're 39% Caucasian and 32% Hispanic. In terms of age, 44%, or roughly 50,000 people, are under the age of 19, and 8,700 people are over the age of 65. So do you mind if I take just a really quick moment to talk about some of the successes of the Affordable Care Act? So through the help of Congressman Huffman and the Affordable Care Act, we have been able to infuse money into the county. Medi-Cal providers in the area receive 2.5 times more for primary care services than they did prior to the Affordable Care Act. In addition, in 2016, In 2016, Sonoma County providers received over $12 million in quality incentive payments. We're talking about primary care providers and specialty and hospital. Sonoma Medi-Cal recipients are better off. We now have a vision program. We now have a podiatry program. Everyone may recognize these services as being cut during the state budget a couple of years ago. But I want to point out a really important fact. From January 2014 through September 2016, we saw a 37% drop in emergency room usage. So without Medi-Cal services, these individuals will be going back to ER services that they received from their primary care doctors. Not only, as everyone here understands, is ER the most expensive spot to access health care, but it also clogs the ER for individuals that actually need emergency services. So I really thank you for the time. I thank you, Congressman, for holding this town hall, and I look forward to your questions.
Hi everyone, my name is Yasmin Peled. I'm the Northern California organizer for Health Access California. For those of you who don't know who we are California's Health Consumer Advocacy Coalition. We've been around for 30 years advocating for more affordable quality health care for all Californians. We were the lead organization to implement the Affordable Care Act, and so we drafted and sponsored a lot of the legislation in Sacramento that took that federal law and put it here in California. And so we are leading the charge to try to defend it and to talk with folks like you all over the state about what you can do to help in that effort. And so as the congressman said, they did release the legislative text today. And they plan on having the initial committee votes on Wednesday, so you will have to forgive me if I look at my phone a little bit during the next 2 hours. I'll do my best, and we'll all do our best to answer your questions about what might be in this bill. I can tell you from first glance it's not good, and we will have to do our best in this next month to really put an end to this debate. So I look forward to answering your questions, and it's really inspiring to see so much engagement. You know, I see pictures on Twitter all the time of these town halls, and it's really great to finally be at one and to see all of your faces. So thank you so much for coming out today.
Thanks, everybody. All right, so let's kick it off. Why don't we take 5 people that who wants to ask a question at the podium? Come on, first 5. First 5 to the podium. Make sure.
All right, so I'm going to call up 5 names that submitted cards to be asked in person.
Oh, okay.
So Jody Reed, Judy Patrick, Kathy Powell, Brian Stomp, and Luke Entrup. Those were the first 5 that had asked to speak in person.
And we'll alternate between folks at the podium and cards that I'll ask Jenny, my fantastic district director, Jenny, to read.
So, hi, my name is Ruth Carter, and I'm here speaking for Jody Reed and for the California Alliance for Retired Americans. Thanks. We're so gratified to see people standing up and fighting back against the proposed cuts to our health care. Across the state, CARA has been organizing rallies. The last one we organized was in Sacramento. The one before that was outside of Kevin McCarthy's office, who's the House Majority Leader, and he had his door locked. He would not let us in. So we're very grateful that we have a representative in Congress who is willing not only to meet with us, but to support the furtherance of health care for all. So I just want to let you know that CARA is California's largest grassroots senior advocacy organization, and we are glad to be here today. So I'd like to let you know that here in the North Bay, we have a chapter that meets monthly in San Rafael and represents both Marin and Sonoma counties. We would like to invite you to join us. I have cards here that give you information about the kinds of meetings that we do. We invite you to join us to help us with our planning, with our educational outreach, and with the rallies that will be coming in the next few months. Thanks.
Thank you very much for all the good work you're doing, especially down in Bakersfield with Kevin McCarthy. That's good stuff. He needs to hear from you.
Thank you for this nice forum here and the good job that you're doing. An insurance company can't prescribe an aspirin, and certainly the United States is big enough to self-insure, and it's so nice to hear that you're for single payer. It does not make sense to dump public funds or your own funds into an insurance company that can't do health care. We should be putting those funds into the providers that do health care. And House Bill 676, I know that you've signed on to that, and I had two questions. One, they're both the same, about two different bills. That one, and the bill that's just been introduced into the California Senate 562, where we could get this thing done with the world's sixth largest economy and get it done one state at a time. Do you think that the House bill could get enough support, or are the insurance and drug lobbyists so powerful that it'll never go anywhere?
Do you want to? Is that your whole question, or do you want to ask both?
And then secondly, do you think that California can get this thing done with the Senate bill that's just been introduced, and it's already been passed twice in California, 2006 and 2008. Can we get it passed again and get it signed by a Democratic governor? Thank you.
Terrific. Well, thanks for your questions. And let's talk about the efforts to advance single payer in Washington right now. I've been a co-sponsor of the Medicare for All legislation led by John Conyers for the last 5 years now. And I'm not familiar with the Senate bill, but where I am basically on this is, even though I have no illusions, I mean, single-payer legislation is not likely to pass in the next year or two, maybe a few more. But I want to keep moving us down the road because I think it's inevitable that the United States will have some type of national health insurance, just like every other developed nation in the world. And the other strategy that might present itself, and I'm a huge fan of this as well, is if you can't go all the way to single payer, how about opening up Medicare for people at an earlier age to buy in? That would make a lot of sense. So, maybe you start at 55, 50, something like that. Pretty affordable insurance product. It's a lot more efficient than private insurance products. People seem to really like Medicare. And by opening it up, you could also help stabilize the trust fund because you're bringing younger, healthier people into the risk pool. Right now, Medicare serves the most costly demographic, right, in our population. So it seems like a win-win that could help us solve part of the problem, maybe take us a little incrementally further down the road. Now, could states take this on and do it themselves? When I was in the state assembly, voted for single-payer health care as well. We actually got it to the governor's desk once. It was vetoed. There's no reason they couldn't. They might need a waiver, a federal waiver, which I doubt that this current administration would provide. But they're also going to need to come up with the financing, and we'll have to have a very honest conversation about that. If a state wants to go it alone and do single-payer, it'll probably be more expensive. And it's going to involve some tax increases, offset by the fact that you don't have to pay insurance premiums anymore. But it will draw you right into that fight over taxes that we see from time to time in Sacramento, and probably require a 2/3 vote because it's a tax increase. So the politics of it are daunting either way. That doesn't mean we give up. If you agree with me that it just makes too much sense not to keep pushing this, we should. And we will eventually get there. Thanks for your question. Jenny, why don't we alternate with the cards? Do you have a question from the card, and then we'll go to the next speaker at the podium?
Okay. So I have a question from Dennis in Petaluma, who asks, why does Congress continue to receive health care, et cetera, for life and congressional duty? Will there be benefits to be taken away along with others in the interest of the budget?
Read that last part again. I missed that last part. I was so surprised by the fact that I get health care for life. I did not realize that. But
Yeah. Will these benefits be taken along with others in the interest of the budget?
Got it. All right. You're not going to want to speak to this. This is me, and this is my world of stuff that swirls on the internet. There are so many myths out there about perks and benefits that members of Congress get. And one of the most prevalent is that the minute we show up, our student loans for our kids are all forgiven, and we immediately vest for a pension for our life at full pay, and of course we get these Cadillac health care benefits for life just from showing up and taking the oath on day one. Totally not true, folks. I really wish we could put these things to bed, but they just live on and on and on. So get to know a fact-check website. Go to Snopes or PolitiFact or one of these other things. You don't have to believe me. You can actually go and sleuth it out on the internet, but this is really false. In fact, it's actually quite the opposite of that. There's only one group in America that is required by law to buy Obamacare. Members of Congress and our staff. So where do I get my health care? I go on to the exchange, and I shop around just like everyone else in the individual market that is getting health care from the Affordable Care Act. And, you know, I can tell you it's not perfect, but it works. It's a lot worse than the plan I had when I started in Congress. When the Affordable Care Act kicked in, I actually got a much worse plan that with higher deductibles. So, you know, I'm kind of living that reality too. But the idea that members of Congress have gold-plated health insurance for life is sadly not true. All right, let's go over here.
Yeah, name is Ron Nato, and I'd like to know when the state of California will fix the workers' compensation program. I'm sure there are a lot of people here who have been on workers' compensation and have had difficulty getting their treatment approved. It's taken over a year for my wife to get final approval on knee replacement, and we had to retain an attorney in order to get that approved. One of the things that many people don't know is once you sign on workers' compensation, if they refuse your care, you can't go to your insurance carrier because that's excluded. And so I hope that our people here in the state of California will see some progress on making that change.
Thanks for your question, Ron. I'm really sorry that you're stuck in that position. That's a question of state law, and really it's something that maybe Senator Dodd would have been happy to speak to. We'll pass it along through Logan to the senator, and perhaps he can get back to you with what they're working on to fix the workers' comp system. Thanks for your question.
Thank you, Congressman Huffman, both for hosting this event and for your service. My name's Luke Entrup. I work for West County Health Centers. We're one of the wonderful community health clinics in Sonoma County. Community health centers are responsible for serving, as we heard, over 100,000 people in Sonoma County. We provide over 500,000 medical, dental, and behavioral health visits. In other words, 1 in 5 people in Sonoma County receive their health care from community health clinics. And I'm guessing that may include many people in this room. So community health clinics have always played an important role in keeping the county healthy, but also by serving some of the lowest income people in our community. 65% of low-income residents receive their health care from community health clinics. So these are people with income of $35,000 a year or less. Now, since the implementation of the Affordable Care Act and really over the last 3 years, we've seen the rates of uninsured go from 14% in Sonoma County down to 7%. So this is through the expanded Medicaid program. If it's repealed, we'll see probably about 32,000 people in Sonoma County lose health insurance that are through this expanded Medicaid program. And so obviously, it's a source of great concern for our patients and for our communities. I was hoping that you might say a few words about what the role of community health clinics and what we're doing to prevent the rollback of Medicaid. I just saw in the bill that was released today, there's a plan starting in 3 years to start rolling back Medicaid expansions. So that is absolutely on the table. Wondering about what we can do to prevent these efforts, and also what role the state might play in pushing back or stepping up to the plate if this does in fact happen. So thank you.
Thanks for your question, and thanks for the great work that you and others at our community health clinics are doing on the front line of healthcare in a lot of underserved areas. And I'm glad to hear the numbers that you've seen, the improvements you've seen in Sonoma County. We've actually done even better than that statewide. We've gone from 17% uninsured down to 7%. So that's important stuff. And the support for community health clinics is a big part of how we've gotten there. Not just providing primary care, but also dental care, mental health care, including mental health parity under the Affordable Care Act. So we've got a lot of improvements that have been hard won that really we don't want to see go away. But let me ask our panel to speak, though, to the direct question that you asked about care and the community clinics and what it means.
So I think, in these areas, our community clinics really are the backbone of our healthcare providers in the area. And we take, thank you, I do. I applaud the work you do. I applaud the work you did before the Affordable Care Act, and I think the work you're doing right now is absolutely stellar. I share your concern about the rollback of the Medicaid expansion effective 2020. That's according to the Wall Street Journal about, half an hour ago. But I do want to talk about, not only the health care you provide, but I want to talk about the jobs you provide to the community. We, as a health plan, want to stand in solidarity with our community health care clinics and note that we are concerned about over 1,700 jobs in this county, healthcare jobs. We're concerned about these jobs being lost in the county. We're concerned about the over $288 million that the Affordable Care Act repeal would mean for the county. You talked a little bit about earlier what can we do to make sure that we're helping preserve the system of care that we currently have. Between now and 2020, we must make sure that anybody that can be enrolled in Safety Net Health Plan is enrolled in Safety Net Health Care. The federal government is looking to freeze enrollment, so anybody that is currently uninsured or can be insured, you have to talk to them. We have to make sure that the funding is preserved between now and then. You must support the legislators that are talking about our cause. The devil is in the details on this. We must use a scalpel and not a hatchet. We must keep people accountable. So the work you do is very important to us, and I thank you.
So just to add on a little bit about the proposed changes to the Medicaid program. So yes, it will be to freeze enrollments into our Medicaid program, to phase out the expansion. And the expansion helped a lot of different folks. It first increased the income eligibility for the Medi-Cal program here. So it expanded it to those folks. It also meant that it allows childless adults to be able to get on the program if they're income eligible. Before the Affordable Care Act, if you did not have a child and you were low income, you couldn't get on the Medi-Cal program. The ACA opened that up for folks, and it opened that up for folks across the nation, which is why the Medicaid expansion and any rollbacks will probably be what ends up being the saving grace for the Affordable Care Act, because there are a lot of Republican senators and governors who realize that the Medicaid expansion has been good for their state and for their people. And so that's something to be aware of. What they also want to do, besides phasing out the expansion, is they want to fundamentally change how the Medicaid program is administered. So right now it's an entitlement program. It's basically like a waterfall, right? The state gets all the money it needs for the program from the federal government, and it's a shared partnership, state-federal, right? What they want to do is change it to a per capita cap. So every state gets a certain amount of money based on enrollees in the state, and that's as much money as they get. It's very similar to a block grant. When you hear this, you'll often hear it along with the phrase, it increases state flexibility, it makes it easier for states to innovate and do all of those things. No. That's a Trojan horse. It doesn't do that. There's already plenty of flexibility in the Medicaid program. States can apply for innovation waivers and can do all sorts of innovative things. California does it all the time. This cuts the program. It cuts the entitlement. It takes care away from people. It leaves people out. We get a lot of money from the federal government to administer the Medi-Cal program here. And so by phasing out the expansion, by turning it into a per capita cap program, we will be losing billions of dollars from the federal government to administer the program.
And maybe disproportionately hurt because California is actually more efficient than many other states in our Medi-Cal program. So you impose a per capita formula. The states that have been highly inefficient start with a better baseline for continued funding, right?
Exactly. And so by taking away all of that federal money for the state to run the program, it now ties our hands on how much more could the state offer, right? Because since it is a state-federal partnership, if the federal government takes away tens of billions of dollars away from the program, there's only so much reserves that the state itself has to be able to backfill. And so you have to think realistically, what is Jerry Brown willing to do and how much money is realistically out there.
One reason the expansion was so successful is it offered a higher federal reimbursement than the normal Medicaid.
Yeah,
right?
And right now the federal government pays 95% of the Medicaid expansion population. That was supposed to trickle down to about 90% at full implementation of the Affordable Care Act. So the federal government is paying the majority of that money. If that were to all go away, there's not really any way that the state can make that up. That's $17 billion. And that's not even going into the per capita cap situation. That's even, 25% more of our Medicaid funding loss. So it sounds bad, right? But this is bad across the country, which is why it could help be the reason the Senate doesn't move on this.
Let's hope. Frank or Carol, did you have anything to add about clinics? All right, we'll keep going, but before you leave, Lou, I want to ask you one quick question because this is an important issue. I've been talking a lot to the immigrant community and advocates for the immigrant community and educators and others, and I'm actually hearing stories about parents that are afraid to take their sick kids to the clinic because they are afraid that by getting care at a government-funded clinic, they're somehow in the system and more likely to be targeted for deportation. Can you just speak to that? I don't want to have anyone in this community afraid to take a sick kid to a clinic. You're not checking immigration status, are you, when you're serving people?
Community health clinics will see anyone, anytime, regardless of their immigration status, their income, their ability to speak English, their race, their sexual orientation. We are the healthcare safety net. We're not a governmental agency. Most of us are private nonprofits, and we see people regardless of who they are, where they come from, and what language they speak.
Great, thank you. All right, want to go to the cards?
Okay, Michael from Sonoma asks, how would the interstate health insurance market work? And wouldn't a competitive market lead to big companies gobbling up smaller ones, leading to less competition? ?
Great question, because one of the Republican talking points, and Yasmin, you've snuck a peek at the bill. Maybe you can tell us if it's actually in there, but their answer to a lot of these how do you replace the Affordable Care Act questions has been, well, we'll just let people buy insurance across state lines, which sounds, flexible or something. But in truth, it really allows carriers in weakly regulated states to cherry pick healthy people in places like California where we actually have standards. And it's going to be really bad for a place like California, if it even works at all, because you have 50 different insurance commissioners, 50 different sets of state laws. And my sense, again, I really want to look at this bill to see what's in there, but my sense is that without some kind of federal preemption of state law, I don't know how you pull that off. I don't know how you just plug in a bunch of out-of-state folks having them be subject to 50 different sets of laws. So normally, federal preemption is something my Republican friends don't like to do. So it'll be interesting to see how they navigate that piece of it. But let me invite other members of the panel to speak to this issue if they'd like.
From what I've read so far, I don't believe the selling across state lines is included in this current piece of legislation. I will say that there are some pieces of legislation here in the state of California that are backed by some of the Republican local state elected officials who want to sell across state lines and sort of bring that policy here to California. So we are obviously outright opposing those proposals because, like the congressman said, it's a way to get around California's insurance regulations and protections and make sure that you get a good plan, right? If you get sick and you have a plan from Kansas that doesn't actually cover anything, the state of California can do nothing to help you if you have purchased that plan. We also, one of the major concerns with selling across state lines is what happens to maternity coverage. What happens to all of those folks? Yeah, I see a baby right there, right? So it's diabolical to sell across state lines. It's also not illegal.
It's a good word, diabolical. I don't hear that.
It's also not necessarily illegal right now, but no state does it because all the insurance commissioners know it doesn't work. And so that's why they haven't done it.
So this is more of a campaign talking point than a
Yes.
serious health care proposal, it
Yes.
sounds like. Yeah. Any other thoughts about this?
I also think it's important to note that in the new proposal that the mandate to carry health insurance is going to be repealed. So if you look at the individual's ability to buy health care and afford health care, now all of a sudden the young invincibles are now no longer part of that pool. And so what does that do to the general spending power of each population, which is really important. And then also there's this federal law called EMTALA. If you show up in an emergency room, you must be treated, regardless of if you have health care in Kansas, or regardless of whether you have health care in Wisconsin. So if you do have health care from outside of the state, and you show up in an emergency room, California is still required to carry the burden of those health care costs. So, diabolical, I agree. And I think, it's really important to look at the details and figure out how they actually can be implemented.
Thank you. All right, next.
Hi, I'm Kathy Powell with the Petaluma Health Center. So we have two health centers represented here.
All right, Petaluma Health Center.
Thank you. And we take care of 30,000 local residents, 7,000 of whom have coverage now from expanded Medicaid, Medi-Cal, and the ACA. The economic impact that repealing the ACA would have is even more significant than the lack of insurance or the lack of coverage, medical coverage that we can provide, because the health center will always be here. West County Community Health Centers will always be here. We'll always take care of our patients, but they won't have the extra coverage from being able to go to specialists and hospitals and have other diagnostic work done that they can't afford. So if we look at just the economic impact as an argument for the Republicans, because the economy is a big talking point for Republicans, if we look at Sonoma County alone, I think the total impact of the expanded Medi-Cal and the ACA, the Affordable Care Act, all the insurances, is over $400 million to Sonoma County alone. $400 million. And it's more like 4,000 to 5,000 jobs, which, if you multiply that across the country, surely are more jobs than the president could possibly bring back in manufacturing.
Do you know, does that economic impact include the benefit in terms of productivity of people being healthier and actually able to get into the workforce?
It doesn't even include that.
So it might even...
Or being in school.
Yeah, there could even be a bigger multiplier to that.
So it would be great if that could be included in congressional discussions.
I'll do my best. Yeah. Ready? From the cards?
Okay, there's two kind of specific questions about what happens to California, covered California. And so Noreen is asking, if ACA is repealed without a replacement, isn't it true that people could still be covered for a year since contracts have already been signed for a year? And related to that, these are people wanting to know what happens to them right now. So this person, Becky, is retiring at 62 in May and will be part of Covered California. And if ACA is repealed, could the rates change from what I am quoted now?
Was there another part to that, or is it?
Those are two.
Okay, so that sounds like a question about that takes us back to our trusty reader of the Republican plan on our smartphone. Yeah. What do they do about people that have secured insurance currently? Yeah. I assume they're not going to repeal current insurance contracts.
Yeah, so if you have Covered California now, the rates are set, so you shouldn't be worried about you losing coverage in 2017. And again, everything in the bill is set to delay until after 2018 or 2020.
Why would they want to delay until after the 2018 election?
I wonder. But there is a concern for 2018 because even though Covered California will still exist, there is a lot of instability in the marketplace. And what do insurance companies do when there's instability? They put up your premiums. And now, yes, the subsidies are meant to rise with the premiums rising, but you have to look at our current HHS secretary and what he believes in premium support and, subsidies. So it's concerning. Premiums, for those that are left in the individual market going into Covered California, the premiums for 2018 are a concern. And I will say that their proposal for post-2018, post-2020 is that the subsidies would no longer be given to people based on their income. So right now, if you're low income, you get more subsidies than someone who is higher income. Well, in the new proposal, the subsidies would be based on your age, not your income. So if you're 22 and sick versus if you're 55 and healthy, who do you think gets more premium support, more subsidies? The 55-year-old person, not the sick 22-year-old. Now, in this finally released version, they have put some caps on it so that more wealthy folks will not be getting these subsidies, and they phase out at a certain income level, $215,000 a year or so, but still.
That's the poverty level in the Republican world, actually. So
I'm going to use that line. So, there's just so much concern here. I mean, this doesn't fulfill the campaign promises of we're going to have a better healthcare system, we're going to cover more people. This doesn't, do anything to make coverage more affordable for people who don't find it affordable now. This only makes it worse for folks. So it's not actually helping people.
Okay. I want to go. I feel guilty we haven't had any kind of Medicare-specific questions, so I'm going to take the congressional privilege here and toss one over here, and I think Carol may want to speak to the question that was just asked as well. But here's something that I think a lot of people are wondering. The Affordable Care Act actually was very good for Medicare recipients as well. It helped to stabilize the Medicare trust fund. It also helped to bring down the cost of some prescription drugs. So if, again, I don't know what's in the Republican bill, but I'm guessing I know what they want to do to Medicare, so I'm guessing there's something in there that takes us backward on both of those fronts. So tell us, advocates and experts on Medicare, what this means.
Well, I wanted to say there's certainly other mischief afoot that we have heard about. And one of those is raising the age of eligibility for Medicare from 65 to 67. And we have done with economists and actuaries an analysis of what raising the age of eligibility for Medicare at the same time that we are either damping down or canceling the ACA. And it is outstanding increase in the number of people who would be uninsured. 20% of the population that is now would be Medicare age would be uninsured. Even if you had elements of the ACA, if we didn't have the ACA, it would be 40% of the population. And obviously, if you look at communities of color and Latinos, Hispanics, it's going to be close to 60% of that population would not be able to be covered. And the extent to which this would be a huge loss in all sorts of Medicare absolute benefits is phenomenal. So these things are not going separately. There is a lot of other change. There are many changes that are terrible. And as it is, Medicare out-of-pocket costs, they are talking about raising the ability for insurance companies to charge people who are older not 3 times more than younger people, but 5 times more than younger people, which would be estimated to be $2,000 to $3,000 a year more in the purchase of any kind of insurance for older people. So we're talking about socking it to the kids, we're talking about socking it to all of us, and socking it to elders too.
And for those of you that may not be aware of some of the parts of Medicare, of course, there's a drug component, a prescription medication component called Part D. Now, in Part D, how many of you have heard of something called the donut hole? Okay, a few hands, a lot of hands. When a person has a Part D drug plan, at the beginning of the year, January 1st through December 31st is their plan year, as they fill their prescriptions, the cost of their prescriptions is tallied every time that they have their card swiped at the pharmacy and fill that prescription. Now, at the point a person reaches a threshold of $3,700, which is not the amount they pay, but the total amount, which equates to about $825 of what a beneficiary would pay, they hit that threshold and they fall into what's called the donut hole. Now, before the Affordable Care Act, as a person was in that donut hole, they were paying 100% of the cost of their medications. With the Affordable Care Act, they receive a discount, and over time, the hole is being filled in. And right now, when a person is in the donut hole, they are paying 40%, only 40% of that name brand drug and 51% of the generics, with the goal being that by 2020, there will be no more donut hole. So that's a real challenge for approximately 24% of Medicare beneficiaries that have Part D who find themselves falling into the donut hole and have a significant increase in their medication costs as they have to pay a higher percentage of that medication while they're in the donut hole.
A little bit more about Medicare. So, while this current piece of legislation doesn't have any voucherization of Medicare or sort of any concrete cuts to the Medicare program, that's on the horizon, folks. They want to do that, you know, Tom Price has said that's on his agenda for fall of 2017. So, you know, that's something he wants to do. It's something Paul Ryan wants to do. It's on the agenda, so it's only a matter of time till we're having that fight. And secondly, the Medicare Trust Fund has been extended by the Affordable Care Act, right? And that's because there was an increase on the Medicare tax for the most wealthiest Americans, right? So if you earn $250,000 or more, you paid a little bit more in taxes for Medicare, to which extended the trust fund. Well, obviously this new piece of legislation takes that tax increase away, which will, you know, benefit the top 1% and the top 0.0001%, the 400 wealthiest families in this country, will then be getting a $7 million tax cut. So
while shortening the life of the Medicare Trust
yes,
Fund.
and so now we expect to shorten the life of the Medicare Trust Fund. So it's a double whammy here.
Thank you. Those are great technical explanations. Appreciate it very much. Should we go to the microphone?
Thank you, Representative Huffman, and the board for being here and giving us this time today. Appreciate it. My name is Judy Patrick. I'm a retired Sonoma County employee, and I have 3 adult children, 3 grandchildren. The adult children are covered under 2 under private care, 1 under ACA directly, and the children fall under the private care, of course, too. My question to you, and it may or may not be a question, I keep saying to people, they keep saying, well, if I'm privately insured, I don't have anything to worry about because, I have my insurance. Well, part of the ACA put a cap, a no lifetime cap for catastrophic illness. It also, what else was I going to say? Sorry, senior moment there. Pre-existing
all kinds of reforms, though, against abusive
pre-existing
insurance.
conditions. And there's a lot of people are under the impression that those aren't going to go away. And that's part of the ACA. It does go away, does it not?
Well, we'll double check whether it goes away, but I mean, I'm sure it is part of the ACA. Their goal is ultimately to free the world from, the tyranny of all of these reforms. And so,
right.
Yeah, we should be on a path to lifetime caps and discrimination based on gender and kids that can't get on the plans and
right back where we were.
Annual caps and all of these abusive practices that we saw before the ACA. And your point about this perception out there, I think, is a really important one.
Right.
People that get coverage through their employer think that they don't have a stake in this debate about the Affordable Care Act. Well, we have been holding healthcare inflation to the lowest level in half a century because of many of the reforms in the Affordable Care Act. So, you really do have a stake. Remember all those double-digit premium increases that you were getting back before the Affordable Care Act? That's probably what we're heading back to because healthcare inflation should start to rise again. And everybody, whether you get your coverage through Medi-Cal or through the exchanges or through a private plan, should have a stake in keeping this healthcare cost curve as low as possible. Did you have more to your question?
No, just that the pre-existing condition, you could have a hangnail, and they'd be happy to disqualify you.
People have died of hangnails. Yeah.
Thank you.
Comments on?
Well, so the method they're going to use to do the repeal is through the process called budget reconciliation. So there's only so much you can do through that process. The reason they're using it is because you only need 51 votes to pass in the Senate, and they have 52 votes if they get all of their senators to vote. They don't have 60 votes, and most of the Affordable Care Act was passed by the Democrats with 60 votes. And so there's certain things like the pre-existing conditions clause, the no annual or lifetime caps, things like that cannot be changed through the budget reconciliation process. Because the budget reconciliation process can only be things that have to do with the budget. But there are things they can do to undermine along the way that effectively, take away some of those reforms. And one of those that we're most concerned about is the continuous coverage clause, which is where if you, let's say you lose your job, you aren't able to get health insurance for a couple of months. Under this new piece of legislation, if you don't have health insurance for 2 months, the next time you try to get health insurance, you're paying 30% more on the premiums straight to the insurance companies. And so, you could have lost your insurance for a number of reasons beforehand. And let's say you're a sick person, that's basically charging you more for a pre-existing condition, right? Because, you're being charged a 30% surtax straight to the insurance companies.
And if you've fallen on hard times, miss a payment after you lost your job, don't have the money to suddenly pony up 30% plus on those premiums, you're out of luck.
Yeah, and remember now they've also want to get rid of the Medicaid program, so you wouldn't be able to rely on the safety net. So what do you do?
So the point that Yasmin is raising about major parts of this Republican repeal and replace proposal going into this budget reconciliation bill so that it can get through the Senate on 51 votes is one of the many reasons maybe that Donald Trump has finally realized this is complicated, right?
Yes.
Because there are other parts that are going to have to be in separate vehicles, and one of the things I'll be real interested to see when I read their bill is from a parliamentary standpoint, how have they interpreted, whether stuff comes in under this 51 vote vehicle versus the stuff that has to be left behind in a separate vehicle. And, they have some influence on these parliamentary rulings as well. So it's going to be very, very interesting. Any other thoughts about that piece? Let's go to our next question then.
Thank you.
Thank you very, very much for your question. Okay.
So the next 5 people that requested to ask their question in person: Rosemary Kumar, Stephen Braver, Bill Remick, Gus Mangus, and Patrick Mundy. And then while they're coming up, there was one other question I would say, Congressman, the most popular question of the night, I would ask you to guess it, but it's...
what can I do?
No, it's actually about single payer. And I think all these questions... Okay. Maybe you can spend some time. They're all about different, what is the strategy and what are the odds for single payer. And maybe everybody wants to raise their hand if they're for single payer.
How many people are for single payer? Yeah. All right, that's impressive. That's good stuff. I guessed the what can I do part because that's really the question I get everywhere I go. What can we do? How can we make a difference? How can we be part of the resistance, right? I want you to know that that's a conversation that we need to have. There are limits in a public, kind of taxpayer-sponsored event to how far I can go with that conversation right here with all of you. But we'll look for creative ways to have that conversation. The one thing I can tell you is that I think what you are doing right now, caring enough about these things to come forward and be active citizens, and I hope you're going to other public meetings and Board of Supervisors things and looking for ways to even go outside of my congressional district. Just being engaged like that is a key part of what you can and I think should do at this moment in our history. Let's talk about single payer real quick and the strategy for that. I've told you that I support pure single payer. I support incremental steps to single payer. I've got a colleague, Peter DeFazio from Oregon, who has an interesting idea, a little bit like the public option that was considered and frankly should have been part of the Affordable Care Act. If we can bring in the public option, that would be a good incremental step towards single payer because it would help places like the remote counties I represent in the north and places like Humboldt and Mendocino, Trinity, Del Norte. They don't have enough competition. And as a result, in some cases, they're stuck with just one plan on the exchange from Anthem, I believe. And that plan may not have a very robust network of providers. There's lots of other problems when you've only got one plan, and it might be kind of expensive. If you had a nice public option, that would really help, and it would help drive competition as well and keep plans like Anthem a little more honest in what they do in rural areas. But my colleague Peter DeFazio's idea is to create a national nonprofit that would actually offer coverage in exchanges all over the country. I think that's another interesting concept that could help fill in this void for lack of competition. But other thoughts about single payer, where we go from here? I want to tell you, I enthusiastically support this. I think it's essential. I also want to manage expectations that this could be a long slog for single payer. So hang in there, right?
Yeah, I mean, the only comment I'll make is that while it does save money down the road, there is an initial investment required. And so, like the congressman said earlier, then you're in the difficult conversation in the state capitol on taxes. And you can't necessarily rely on having a Democratic supermajority to pass all those taxes. You can't necessarily rely on a Democratic state to pass them through the ballot box. And again, if we lose the Affordable Care Act and all the federal money that comes from it, now we're even more in the hole. And so this is why it's so important that we maintain the ACA. We don't lose that federal money, because if we have to go back to that old floor, we're even further away. So it needs to be the vision, and I think it continues to be the vision for a lot of folks, but we have to be realistic about what happens if we don't win this initial fight.
Also, I want to say that for people who are age 55 to 64, assuming that the age for Medicare eligibility is not raised, for those people, if you are out of a job, you're out of your health care coverage, your ACA gives you some protection through the Medicaid subsidies, or Medi-Cal as we call it, to cover your expenses. And if we lose the ACA, this is going to be really difficult for the near elderly. And so it's another knock on people who've lost their jobs, the economy, and all that. And age is a very important factor. So for that group, assuming the insurers who are lobbying Congress now to raise the amount insurers can charge to 5 times what younger people can be charged, it's just going to be impossible for people who are trying to get health care covered in between losing a job or being forced out and Medicare age.
I also think it's important to point out that Medicaid subsidizes Medicare. So if you're a dual eligible low income individual over the age of 55, your provider that is giving you your care is relying upon your Medicare dollars, but they're also relying on your Medicaid dollars. So once those Medicaid dollars go away, what happens? The Medicare costs go up. So it's really important to understand that these things, although are unrelated in many people's eyes, are financially connected. The public option in this county has a 4% administrative cost. So if you look at the way that we're just saving health care and we're able to, you leverage the public dollar, what makes more sense? A 4% administrative cost or something a little bit higher?
Hello, my name is Mary. I've been a longtime activist for single payer, and I am a card-carrying member of the California Nurses Association. I just wanted to thank you for all the wonderful work you're doing, and whether you like it or not, we'll be on top of you, underneath you, around you. You'll look around, and we'll be there. We face some hard times with the right to work legislation that's coming up, but I don't think that's going to stop us from ever giving up on single payer. Thank you again.
Thanks, Mary. Thanks for the work that you and your fellow nurses do.
Hi, my name is Donna Norton, and I'm a long-time advocate for single payer. I used to also be an insurance adjuster or a claims adjuster. But I think all of us here, from the show of hands, almost everybody is for single payer. Also, I think that does not diminish the fact that all of us here are in support of not pulling the rug out from under the Affordable Care Act. But I think most of us here understand that that's not the final solution. And my feeling, or what I'm concerned about, is under the ACA and the type of program it is, that stability and reliability for those recipients is always in question. Because, first of all, because of the kind of program it is, it depends on Congress working together. We've seen that isn't working. You've got one side trying to defeat everything, the other side trying to expand everything. We've seen how you get one president in and he says, let's take away all these things. So the way the program is set up, it will continue, to be subject to that. The second thing is that it depends on the states accepting what is put out there. And we've seen that a number of them did not go for the bait of saying, hey, we're going to subsidize this tremendously. So right now, the states are way the majority Republican and the legislatures. So it's always, this kind of program is always going to be subject to how the states want to dish it out, or if they do. So again, with the recipients in mind, this is terrible. You don't know whether you're going to have it, or have it taken away. The other thing that the ACA depends on is participation by the private for-profit insurance industry. All they have to do is withdraw from the market. Excuse me, I didn't mean to yell. So these are all, this is all part of it. With a single payer plan, say in a state like California, you have 40 million people almost. You have an economy that, could support this, and you have a separate law. If they enact single payer, a governor, whatever, can't change it. Okay, so anyway, these are the things I'm concerned about, and I think we need to really push hard for a single payer system so that we don't get stuck with all those things. Thank you.
Points. Thank you. Thank you. Jenny, do you have some from the cards?
So a number of people want to know what the strategy is to influence your fellow Republicans to ensure that the ACA is not repealed. They're looking for strategy, specifically, and also wondering how the judiciary can be utilized to put the brakes on the changes to the ACA, and is there a legal way to slow down the repeal?
Yeah, good questions. So one of the main pieces of the strategy to try to push back and resist this repeal effort, believe it or not, is town hall meetings. And it's happening very organically. It's happening all over the country from people who have benefited under the Affordable Care Act, maybe got coverage for a loved one that might not have gotten that cancer treatment, or for a kid that had some serious condition. And the idea of suddenly being thrown out to the tender mercies of the insurance industry again without these reforms is pretty scary to millions and millions of people, and they are showing up at town halls. My Republican colleagues are having a very different experience at their town halls than I'm having. And a funny thing is happening because it's really, we've sort of gotten past debunking that these are paid protesters. These are real people. They're showing their zip codes. They're ready to show IDs if they have to show that they really are within those districts. And it's moving the needle politically. I read just last week that one of the real hardliners in the Republican caucus, a colleague of mine from Alabama by the name of Mo Brooks, is now really skeptical, almost to the point of giving up, that they'll even be able to repeal the Affordable Care Act because he says too many of his colleagues are just freaked out about this response they're getting at their town halls. So you think about it, you sort of do the math. They've got 40 or 50 that won't go along because they will only support repeal. They don't want to get into the replacement business. That's that many votes off the table. Then you've got the number of Republicans who are in close districts, swing districts, that realize that they're probably going to lose their jobs if they start taking people's health care away. And that basically is your strategy right there, to bring accountability to those folks to the point where they can't get the 218 votes that they need to move something out of the House. Did you want to add to that? Mm-hmm. So the question is postcards, calls, things like that. I think it all matters. I think if you've got the time and the passion to do it, please do it. Do it for Democrats and Republicans. But if you want to maybe target your time and your energies a little bit, you might think about just right here in California. We have a number of California Republicans who are helping the Trump administration and helping the folks that want to pull this rug out from under our healthcare safety net in a way that will be detrimental. Well, look up California Republicans. Just about every one of them are on board. They've all been they've all gone through campaigns where they
Do
have
you want me to list them off?
vilified the Affordable Care Act. Yeah, you're going to tell us?
I can say them. Maybe you can't.
All right. So you can, to the extent that you can target your concerns and feedback to those offices, that could have a desired effect. Yeah, please.
So before I say their names, I'll say this first. To the extent that you have friends or families in these districts,
that's even better.
Or that is more helpful than it just being you calling their office. But I will say that Modesto, Jeff Denham's district, there's a lot of people on Medi-Cal there. Also in the Central Valley, David Valadeo, Devin Nunes, Kevin McCarthy.
Posted online.
And so, look to the Central Valley, look to Orange County,
San Diego.
Look to San Diego, look to Darrell Issa. He was reelected with 1,600 votes. Yeah. And again, to the extent that you have friends and family in these areas, so Central Valley, Orange County, San Diego, I would try to put some energy there. We're also working statewide to set up some phone banks where you can actually phone bank into some of these congressional districts to talk to constituents about their healthcare stories and sort of urge them to call their member of Congress. And so we can maybe work with the office here to try to loop some of you into that if you're interested.
What organization would folks want to contact if they were interested in making those calls?
You would want to contact me. So I'll stick around. I'll leave some cards, and I have a sign-up sheet. So.
Good. And this is not politics.
No.
This is about expressing your concern in opposition to something that would hurt you and maybe relatives and people you know in those districts, everyone in California. The whole California success story under the Affordable Care Act is at risk if these folks do something reckless and irresponsible. So we have a direct stake in it, and I think any members of the California delegation that are cooperating with something that would hurt California and hurt all of you, they need to hear from you. All right, do you want to announce your phone number?
My phone number?
Yeah.
I'll stick around, folks. I'll stick
She's
around.
She's going to stick around. All right, let's go to the microphone.
Oh, website. Well, you can go to, I'm with Health Access California. Our website is www.health-access.org, and my email address, phone number, all of that's on the website. My name's Yasmin, Yasmin, if you can't read.
Yeah, and we have agendas that have Yasmin's name on it and her organization's name that should be available here tonight. And my office will get it for you if you can't get it through those other sources. Did we have one? Yeah, Carol.
I was just going to say we have some people in the audience, Stephanie Wilkinson, one of them, who are organizing and working, doing phone banking in other states to exactly get those stories and get that going. So, National Committee to Preserve Social Security and Medicare .org is a wonderful place, and we welcome your calls, and we have a wonderful website called www.entitledtoknow, and every day you get unbelievable info about what to do.
Thank you very much. Yes, sir.
My name is Stephen Brower, and first of all, I'd like to echo my thanks to you, Congressman, and to the panel for being here today. I have a question and a comment. The first is the comment. Given that we're in a highly polarized environment and we're talking about healthcare, people's lives, I urge you and the fellow members of the Democratic caucus to fight like hell to preserve the core elements of the Affordable Care Act. As many of you have alluded to, it seems like the activism that you're feeling here and seeing here is starting to have an impact in Washington, but we really need you all to fight like hell for the Affordable Care Act. My question is, and I am a member of the Community Leadership Board of the American Diabetes Association. My question is, what are we going to do, what are you going to do to fight prescription drug inflation? And I would say start with insulin, which is dominated by 2 pharmaceutical companies, and where price increases bear no relation to the inputs to the drug. It's all about margin enhancement.
Thank you. Thank you for the comment and the question. Let me just say in response to the comment, the entreaty for me to fight. This is not the political climate that I want to be working in, folks. I'll be very, very honest with you. Some of you have known me for a long time. I got into this public service business because I want to do stuff. I want to make a difference. I want to solve tough problems. I'm kind of a policy wonk. And I actually enjoy the constructive friction that exists when our 2 different parties are throwing out ideas and debating them, hopefully with the goal of eventually finding things we can do together from time to time. I had hoped when I ran for Congress in 2012 that I could maybe help improve the tone and help improve the outcomes, make Congress a little more productive. I still want that. I really do. But it's very clear to me right now that that's not the way I've got to do my job. I am much more of a pugilist right now.
Right.
And I am very clear that we are not going to get Congress turned around. We're not going to get back to that productive, constructive friction where we do things and improve people's lives and make a difference unless we win these fights right now. So I get it. Now, on your question about runaway drug costs, this is another big, big deal, and I want to invite feedback from everyone on the panel on this one. But there's a number of things that I think we need to be doing. We may be able to do some of them in a bipartisan basis. I mean, we've heard Donald Trump say that this is a concern of his. He was really rhetorically letting the drug companies have it for a while, and then he had a bunch of the CEOs into the Oval Office, and afterwards he said they're just wonderful people. So, you know, I don't know what we're going to get from Donald Trump, but at various times he has really taken them to task for high drug costs, and he's talked about, for example, letting Medicare, Medicaid negotiate for better prices. That's sort of a no-brainer. We ought to be doing that, letting folks purchase medications from Canada, other places. I think that's probably a good idea too. I think the generic drug market is very important, and I think we have to crack down on abuses that we have seen from some of the big drug companies that have actually engaged in anti-competitive actions to pay generic companies not to produce drugs so that they can continue to have their high prices and their monopoly. That, we ought to just crack down on that, and it ought to be absolutely illegal. We've seen folks abuse patent privileges. So I'm familiar with one case where an asthma inhaler had to be changed because the California Air Board, I believe, had a new regulation about the propellant in the inhaler. And so the drug company that had this product past its patent life and now had to offer it very cheaply, there were generics, there was competition, suddenly reformulated with a new propellant,
Right.
reopened that patent, and had exclusivity again and jacked the prices up by multiples.
Yeah.
So you see these kind of gouging actions, and something has to be done. My preference would be, because there is a downside if we have iron-fisted price control that can limit innovation, it can limit new drugs coming to market. But at some point there has to be a backstop for consumers.
Right.
And I think that's a conversation we desperately need to have. And there needs to be a point at which the government does step in to protect you from that type of abuse. So, yeah.
Where that challenge is quite a challenge, there is one thing that people, and I'm speaking specifically to those on Medicare, can do, specifically related to their prescriptions. You're aware of the October 15 through December 7 open enrollment period. You're probably aware, or maybe you're not, that every year the Part D drug plans that contract with Medicare change. Last year there were 31. This year there were 24. 2 of them got sanctioned, so technically there's 22. We so often meet with people who are not aware of their opportunity to search the plans, because the plan you choose is specific to your medications. So every pill has a price. Not only the pill you take and the plan you choose, but realize each plan contracts independently with each pharmacy down the street. So which pharmacy you get your medication at has a huge impact on how much you will pay out of pocket at the end of the year. So doing that Part D plan search each year during the open enrollment period, October 15 through December 7, is critical to managing some of those costs that you may not be aware of. And you can do the search, you can have someone do the search, HICAP does the search as a service. There's opportunities for you to look at how you can become more educated and manage those costs while these things are in motion.
On the issue of prescription drugs, this is something that the state can take action on immediately. Yeah. And so I would say take a look in this year's legislative session. There will be a bill, SB 17, which is authored by Senator Ed Hernandez. He's down in Southern California. What's interesting about prescription drugs is that the corporations don't need to provide any advance notice or disclosure of the price increases. So you could show up to the pharmacy on Monday and pay something, and show up on Friday and pay something else.
Would this require approval of the insurance commissioner then for price increases, or?
It will not. It's not a cap on pricing. It is a transparency measure. So it would be, insurance companies have to, or pharmaceutical companies need to disclose a certain number of days ahead of time. Here's how much the price is increasing, and here's why. Right now, they don't have to do it. Insurance companies have to do it right now. Hospitals have to do it right now. Why don't pharmaceutical companies have to do it right now? I'll tell you why. The pharma lobby.
Great.
Thank you.
Thank you very much.
Hello, Congressman Huffman. Thank you so much for putting on this event. I'm Bill Remack. I'm on the Consumer Advisory Board to Partnership Health Plan for Marin in Sonoma County. I'm also a member of the Board of Directors of the California Chronic Care Coalition, which represents 16 million Californians with chronic disease. But right now, what I want to talk about is how the ACA may affect our most vulnerable population. And for those of you, many of you grandparents or parents in the audience, we're talking about our children. And the children I'm talking about are our most vulnerable children with chronic illnesses, birth defects, chronic illnesses, catastrophic conditions, terminal illnesses. Now, back in the early 90s in the state of California, we created the California Children's Services. And a couple of years ago, the governor decided that we would take that program that had been working very, very well, that had excellent networks and children were getting excellent care, to merge that into managed care, or Medi-Cal. There was quite an uproar, and many were concerned that children would die. And what was decided in the end was that we'd find a way to make it work, keep all the continuity of care and the excellent care intact, and ensure that no one was harmed. And this is a challenge that's still ongoing. But if the Affordable Care Act is taken apart by this current administration, we will see our most vulnerable children die. And I know what that feels like, because 2 years ago, I lost my granddaughter, 6.5 years old, from a catastrophic genetic disease, and I do not want to see anyone else lose a child.
Bill, thank you. And I'm so sorry about your granddaughter, but thank you. Thank you very much for sharing that with us. Jenny, how are we doing on time? Okay, so let's maybe one more from the card, and then we'll try to get through the folks that are standing there, so they will not have stood in vain.
Thank you. Okay, I'm going to, these are two topics. One is, how will veterans using VA for Medi-Cal be affected by cuts or elimination of ACA? Because there's a number of people that are veterans asking about that issue. And the second one is, there's also another theme that hasn't been talked about as much, and that is around Planned Parenthood and women's reproductive rights.
Thank you. So I can tell you that, Planned Parenthood is a piece of this healthcare discussion that is broadly misunderstood and wildly politicized. Planned Parenthood, of course, only a small portion of its work involves abortions, but some of my colleagues across the aisle would have you believe that that's pretty much all they do. Planned Parenthood serves men and women. Planned Parenthood serves people without regard to their income or documentation status or anything, and they do it in areas that are really underserved, and including a lot of rural areas where there's not a lot of access to care, and even though they're not technically a primary care provider, in some cases they're the only provider some people see, and they end up almost by default kind of performing a bit of primary care. So if you were to somehow defund Planned Parenthood just because you want to play politics with it, there are millions of people who would lose health care, period, in this country, and they just wouldn't find it anywhere else because in many cases there's nobody else doing this work. So lots of reasons why this is a really, even beyond the debate over reproductive rights and choice, which is very important to me and I'm sure many of you, this healthcare piece and Planned Parenthood is critically important. I want to invite the panel to speak about the other part of the question.
So I just want to address the issue on veterans and Medi-Cal care. The eligibility is unknown at this point. We don't think that eligibility will be touched, but I just want to talk about the Medi-Cal care in the county at this current moment and say that any changes to the Affordable Care Act would impact the funding that would go into the communities. In the last year, like I said earlier, Medi-Cal providers received 2.5 times the amount of money they received prior to the Affordable Care Act. They received $12 million in quality dollars. In some cases, specialty care receives 185% of what they were paid in the past. Less money into the ACA means less money to the providers, being pushed back out into the providers. So what does that mean? It means less providers that are willing to contract for Medi-Cal care. It means less quality for those veterans that are looking to seek care. And it also means that the number of providers that are going to be available are simply going to be thinner. Not because networks are going to be constricted, but because with less funding, less providers can actually afford to provide that care. So I think it's important to just talk about less money means less quality and less providers.
We could have a whole forum on the VA and both the health care and the political ramifications. We're going to see some huge fights about the VA in the coming year. And I believe my Republican colleagues and President Trump want to use the VA as the first front, if you will, on this right-to-work agenda that they have. They're going to try to privatize or voucherize and maybe rid of unions the VA. And if you talk to veterans, any veterans in the room? Great. Thank you very much for your service. Thank you. We're glad you're here. What I hear very much from veterans throughout my district, they don't like the bureaucracy of the VA. That's very frustrating to them. but when they finally get the care, they really like the care. It's really high-quality care. It's really specialized to these veterans. And the idea of somehow just handing them a voucher, throwing them out into the private insurance world, it's very threatening to a lot of veterans. So it's something to watch for and to fight against, in my opinion. Other thoughts on this?
Well,
yeah.
In regards to Planned Parenthood, I know there was a question earlier about what can the courts do and where do you see the judicial branch coming in. When it comes to Planned Parenthood defunding, you can be pretty sure that that will end up in the courts. It's not like First of all, Planned Parenthood doesn't have a blank check from the federal government.
There's no line item in the federal budget that says Planned Parenthood.
Yeah, exactly. What they
So
do,
they would have to sort of be singled out for not getting funding.
Yeah, they would have to. You'd have to be explicit in that. And right now, Planned Parenthood clinics basically send a bill to the federal government to reimburse them as a Medicaid provider. And they're only reimbursing for the primary care services and the preventive care services. They're not getting money from the federal government for the abortion services, which are not as much as their primary care services anyway. So you can be sure that that will be something that the courts will be making a decision on.
Yeah. Good. Thank you.
Hi, my name is Patrick Mundy. I'm a Petaluma resident and a member of a family with various aging parents and my own 6-year-old daughter. I'm a progressive activist, and I'd first like to thank the Congressman for all the great work he's done over the last 5 years.
Thank you very much.
I am going to take us back to single payer, and if the crowd would help me out for just a moment, how many of us would like to see at some point in our lifetimes our country join the ranks of the rest of the civilized, industrialized world with a single payer plan? Thank you. So my concern is that I don't actually believe that Congress by itself will ever get us there. I think the only way we are going to get there is if we create a movement similar to women's suffrage, similar to civil rights, similar to opposing various and not so sundry wars. My question to you, Congressman, is do you actually believe that Congress alone will ever get us to single-payer health care? And if you do, could you sketch out a path, notwithstanding that I'm also a member of Northern California's Indivisible group, and we definitely have your back. You can take the gloves off, and we've got you covered in this immediate resistance. Notwithstanding the immediate resistance, how do we get there?
Yeah. It's hard for me to sketch that path in any time frame that would work for. You're a multi-generational family, so maybe the younger generation piece might see it. I do believe that as we continue to flounder in this system that is just really badly broken and expensive, and we could go through the litany of problems with the American healthcare system. At some point, inevitably, we're going to start drawing answers from the rest of the industrialized world, and those answers will take us to broadening the one single-payer system we already have in this country that really works, and that's Medicare. And it will be broadened, and it will eventually, I think, become a national system. But to your point about building a movement, a social movement for this, I think it's a great idea. And I think it should have legs. You're on the right side of history. Another commenter talked earlier about possibly the tactical advantage of moving at the state level first. I mean, California is a big state. It's a nation state. So both of those things seem to make a lot of sense to me. Thanks for your question.
Thanks for the encouragement.
Hello, I'd like to express my gratitude for all concerned who put this together. My name is Justin. Mr. Huffman, I'm sure that you, as well as all in this room, are concerned about the health and safety of our citizens, especially our elderly and our children. I would like to draw your attention to a long overdue public health issue. The practice of public water fluoridation has been going on for decades. Overwhelming statistical evidence has linked this practice with the following health issues: thyroid illness and failure. Anyone in this room with thyroid issues, take note. Kidney disease, bone cancer, skeletal fluorosis, dental fluorosis, which is a pitting and discoloration of the teeth, arthritis, calcification of the hypothalamus, and the pineal gland. Lower
Justin, could you, I think I know what your question is.
Yes, okay, sure.
And I don't mean to be rude and cut you off, but if you've got a long statement, maybe...
that's okay, I'll go to the very end.
I think you're asking about fluoridation.
I'll go to the very end here, although I have a lot of data which I can back up. This, in effect, okay, what, if anything, do you intend to do about this outdated practice that undoubtedly has negative effects on the health of our society?
Thank you for the question. Yeah. Look, this is what do I intend to do? If anything, I'm going to let communities decide for themselves whether they want to fluoridate their public water supplies. And I think as, you know, there's always a movement. I see it pop up from time to time, Healdsburg, other places, where this question is called and taken to the voters. When this debate arises, you hear many of the same points that I'm sure you are going to read. I'm very familiar with those points. There is another side to the argument, and it comes from a lot of people with serious science credentials, public health credentials. So there's a robust debate about this. I'm not going to presume to answer that debate for any particular community. I'll let them decide for themselves.
Can I say one last thing, please? Anyone who is interested in learning about this issue, go online and look up Fluoridation, Cease and Desist. It's a 7-part series, and we'll answer a lot of your questions. Thank you very much.
Thank you, Justin. Yeah.
I've been in line so long, I feel like I've got the wrong envelope. Wow. Congressman, thank you very much. Are we not the luckiest people in the world to live in Sonoma County, where people have compassion, empathy, we care about people? I have a good health plan, but by God, I want other people to have one too. And I'm willing to be taxed to do it. I've had to change my questions about 5 times because you've done a good job answering them. But something I am concerned about that I think perhaps might be of some help. Would anyone who is 30 years or younger in this audience raise your hand, please? 30 years or younger. Thank you. Congressman, we need to get young people engaged. The burn did it. We can't. All these great ideas. The young lady on the far left, man, you're smart. We need you. We need you. We need more like you. We have to engage. We Democrats, those of us who care and have compassion, we've got to figure out how to engage young people. So my question is, what are you personally doing? What are the Democrats doing to engage young people and get them involved so we can gain control back of our country?
That's a great question. Thank you for your comment.
And my name is Les Crawford. I'm the retired superintendent of Roseland School District, so I do know a little bit about health care and about kids and all that good stuff.
All right, Lex, that's great. Well, look, first of all, very, very important question. I want to hear your ideas about how we can do a better job too, but I will just tell you that what I try to do, I spend a lot of time having conversations just like this, maybe not quite as wonky, but with high school classes. And we talk, look, if this election has done one thing, it's kind of provided the mother of all civics lessons. And I'm finding that my conversations with young people find them engaged, interested, maybe kind of stunned, but stunned into a level of interest and maybe action that I hadn't seen before. And we've got to find a way to translate that, to kind of draw them into citizenship and to get them to events like this so that they can ask some questions and feel like they have a stake in some of these things. You got an idea? Mandatory civics. You know, if we had mandatory civics, Donald Trump might know how you get a wiretap warrant. It's a great idea. It's a great idea. Look, I think all of us have to be part of the answer to that question. We got to talk to the young people in our families. We got to talk to young people in their schools. We got to draw them in, let them feel like they are a desired part of these community meetings and conversations. And let me, instead of talking to you I'm young by congressional standards, by the way. I really feel young when I go back to Washington at 53, but we can do even better than that. I want to hear if Yasmin or the others have some thoughts on this. How old are you, Yasmin?
You don't want to know.
She won't give us her phone number.
I'm 23. No. Yeah. Yeah. Well,
Somebody just shouted out, "Are you married?"
No. Yeah, I mean, I would say it's. I mean, I have a lot of my friends aren't really engaged, so it's hard. I mean, you have to. I think the silver lining of the election is I think a lot of people are getting engaged, and I think a lot of people are really frightened and taken aback by what happened, and so I think trying to find productive ways to channel that energy and to have avenues for young people to be able to go into, meetings and places where they feel where they're surrounded by their peers, right? Not going to a meeting with, no, but I think a good mixture, right? If it's a good mixture of folks in these rooms.
Multi-generational. Look,
Yeah.
young people can learn from older people too. We can learn from each other, right?
Yeah, so I mean, it's tough, and I think we have a long way to go to sort of bring more young people into the fold, and but we'll get there eventually, right? Hopefully, we just have to talk. We just have to talk about it.
Thank you. Let's go to our last couple of questions here.
I hate to bring the topic or the subject matter back into a little bit of minutia.
Could you speak up just a little bit, please?
Can you hear me now?
Yeah.
Okay. I spent the whole day today in a very frustrating manner, and the only reason I decided to come here was because of this very frustrating experience. And it had to do with trying to get off of a shared partnership with Medi-Cal. And it was the result of, in 2015, apparently, that the Affordable Care Act intervened in my life in a way that I didn't know would have consequences. And the reason I'm saying this is that I've been using acupuncture for the last, 30 years. And essentially, I've been prescription drug-free for the last 40 years of my life. And I wanted to present, the idea that occurred to me was, I can't get Medi-Cal to pay for any of my acupuncture treatments because of the Affordable Care Act. And so I was trying to get off of that plan so that I could get some reimbursement. And it occurred to me that all this discussion about prescription drug prices and all this other stuff, and it seems like if a person like myself who has had more problems you can shake a stick at can do without prescription drugs, why isn't the healthcare community considering this alternative? I mean, it's not just acupuncture.
So you're, by virtue of Medi-Cal, you're stuck in a plan that doesn't cover acupuncture. You would be willing to pay more for a different plan that did cover it, but you can't. Is that what you're saying?
Exactly.
And
It's
interesting predicament.
Medicare won't cover anything.
Okay, Medicare is the same thing. Any thoughts about this? And I have heard criticism of the Affordable Care Act for not including different types of providers the way that it should. I hear it about mental health. There are certain types of therapists that are not included in the mental health parity. What you're saying is consistent with one of the critiques that is out there. So
what I'm also saying is that there is such a vast cornucopia of benefit from this time-honored method that is blossoming in this country, and why it's not included and embraced more is on.
Well, I'm going to ask our esteemed panel if somebody knows the answer. My guess is that it's the federal board that decides what is included for Medicare, and that translates out into Medicaid as well. But tell me if I'm.
Yeah, I think I'd be happy to connect with you after. Medi-Cal, an acupuncture benefit was reinstated into the Medi-Cal benefit about a year ago, and under limited circumstances, we have an enhanced benefit for the Medicaid population. So let's make sure that we can link you up with the services that are right for you to make sure that your pain is dealt with.
So Robert will be here after. Let's go to our next. Thank you very much.
But I'm just basically advocating also for more in
I hear you. Thank you very much for sharing with us.
Thank you.
Last question.
Okay, last question. Just a quick comment to my friend in the orange, the superintendent. So young people are more interested in income inequality, not necessarily health care. As Congressman Huffman stated, a strategy of the Democratic Party is to have town halls on healthcare, which is a very friendly topic for Democrats, and this has been a very friendly town hall. So thank you, everybody, for that. But
I also have them on climate change,
yeah.
and I also have wide open town halls. So I've actually done more on other subjects. This is my first on healthcare.
So my question here is, Rand Paul scored some political points with his ridiculous health care bill, look and see. And so my question, the question to the audience and also your response, that seemed to be effective, at least in this dysfunctional system of creating this media spectacle, right, around this topic. As you so eloquently stated, you're going to go back to Congress and advance a single-payer bill that, by all accounts, may not be effective. And so the question to you and the audience is, what are you going to do to move beyond this wonkishness and actually fight and somehow engage in these sort of ridiculous Washington battles, which we must do as citizens of this community?
Well, I'm doing everything I possibly can. You got any ideas that I should be... things I should be doing that I'm not?
I mean, take a cue from Rand Paul. I mean, that really worked.
Well, I appreciate the feedback. What Rand Paul did was actually, I think, smart. He highlighted the fact that the House Republicans were holding this bill so secretively that they wouldn't even share it with a Republican senator. So I thank him for doing that and for highlighting it in a way that the media found newsworthy. He brought a portable copy machine over to the House and said, "I'm ready to see the bill," and they wouldn't show it to him. So, I agree with you. I think that was pretty clever politics. I'm always looking for ways to do that too. You want to be newsworthy in the way you advance your ideas, and the media is jumping on every tweet that Donald Trump puts out there. So, there's some competition for their attention, and you got to be more creative. And we will keep working on ways to do that. If any of you have ideas for me, if you think I'm being too dull and ineffective, I want to hear from you. But all I can tell you is I'll just keep doing my best. I think we have the same values. I think we have a lot of the same ideas and goals. Sometimes we disagree on particular tactics, but we'll keep working on it. I thank you for your question. Would you folks join me in thanking our terrific panelists? And I really want to thank all of you for a wonderful conversation about health care. I don't know what my Republican colleagues are so afraid of. These conversations are great. You're great. It's an honor to represent you, and this won't be the last time we get together for a town hall. Take care.